All right, guys, it looks about 7:30, so we're going to get started here.
Okay.
All right, are we ready? We ready to get started?
Yes.
Okay. All right. Good evening, guys. Welcome to the Dolphin tutorial. So my name is Joe Durant, and I'm one of the senior instructors at Acumed. And tonight I'm going to be going over some things with you guys. We're going to talk about how to use the Dolphin Neurostim. We're going to talk about scar release, and we're going to give you guys some time for questions and answers near the end. We're going to go over a few contraindications. So to start out, we're going to start out just by if you guys have been playing with this for a little while, you just have to bear with me. But we're going to go over all the features of the Dolphin right now. So you should have a Dolphin Neurostim that either looks like this or like this. One may have a blue tip, one may have a white tip. But anyway, starting with the tip of the unit, this is your delivery system right here. So a couple important parts about this. So this you need to sterilize between each use, but it's important to remember not to dip this in liquid. So if you want to take an alcohol wipe and clean the tip of it, that's fine. But you don't want to get liquid up in and around here because it messes with the conductivity. If you put alcohol on here, it'll clean it perfectly well. So moving up from there, you have a black button right here. And this button is what activates the unit once it's on. And it only works as long as you're holding the button down. So as soon as you release that button, it doesn't work anymore. Moving down from there, we have our on and off switch. So to turn it on, you simply roll it. And if you look on the other side, you should get a green light that pops on. And the more you roll this little roller on here, the more intense it's going to be. So barely on is just minimum power. And then if you roll it all the way up, you're at full power. And the next thing is a little button right here. And this is our continuous treat button. So once you have the unit on, if you push this button, you'll notice that it stops making any noise. But when I flip it over, you'll see that, let's see if we can catch this here. You'll see that it makes this little light beep on here. So this unit will stay on for approximately 14 or 15 minutes. And after which time it's going to beep and let you know that the cycle is done. And at that point, you have a choice to either hit the button again, like this, or you can turn it off. So flipping to the other side of the unit, there are several things on here, and you'll see a shiny metal plate here. So this is your connection to the unit. So this equipment has to have an anode and a cathode. And when you are treating a patient, your thumb has got to be on this metal plate right here. If your thumb is not on this plate, then you are not actively doing the treatment. So you'll have to have your thumb on this plate, and then you must touch the patient's skin. So it's not enough to touch the patient's shirt or pants or whatever. You have to have skin-to-skin contact because the electricity has to come out of the tip, and it's got to get back into this plate somehow. So it's going to go through the patient's skin and come up through your hand and go into this plate right here. And as soon as you move your thumb off of that plate, you're not doing microcurrent therapy anymore. You're doing acupressure because you haven't completed the circuit. Now, there are times when you might have an electrode pad attached to this, and in those circumstances, you don't really have to touch the unit. So there are a couple of features above there, and you'll see two little slider switches back and forth here. And if you look at these slider switches, on one of them, you will see on the top one, it says polarity. So you'll see a negative symbol. So the negative symbol is for a negative polarity. And that's how we're typically going to use this unit. We're going to use it for bringing things down. So bringing down muscle tension levels. We're going to use that a lot for treating scars and a lot of our general pain treatments. So it's a sedative kind of thing. And in that mode, the electrons come out of the tip of this unit and go into the patient. If you slide it over one, you'll see a little plus symbol. So that's a positive polarity. And that's also tonifying and acupuncture. So when you flip it over to that positive polarity, electrons at that point come out of this metal plate, go into your hand, go down into the patient, and then come back up to the tip of the unit. So it reverses the cycle of electrons, and you're able to bring conditions up or down using that. So if you're using this on someone who is, say, terribly adrenally fatigued, you might want to bring their energy up a little bit. That's an instance where you might use this positive polarity. And sometimes with older clients, you'll find that they are that they have a lot of deficiencies in their joints. So they may have pain, but it's not so much pain from tight muscles that it is pain from the deficiency of just age and time. So in those cases, you may have to use this tonifying channel here. And the next channel on here, which is the one farthest over, you'll see a little plus and minus symbol. So that's a biphasic channel. And on the biphasic channel, the electricity cycles back and forth. So the anode and the cathode flip back and forth between here. And we kind of refer to this as our homeostatic channel. So typically, we'll use this when you've tried a couple of things and nothing else really seems to be working. If you're not really sure what polarity to choose, the homeostatic channel is a good choice. And we'll also use it sometimes when we're working around joints. And also when we get into our SCAR protocols, we'll use this as well as a way to pass electrons back and forth through the scar tissue. So that's all the features on the unit itself. But the next thing we need to go over is this right here, which is the battery compartment. And there are some things you guys need to know about batteries in these units. So the first thing is that the battery compartment is pretty tight, and you're going to need some kind of either a coin or a pocket knife or something like that. And you just want to take it and pop this compartment open like this. So that plate comes directly out to expose the battery. So when you turn the unit on, if the light here is green, that means you've got a good battery. But if you turn the unit on and that light is not green, then it's time to change the battery. Now, when you depress the activation button on the unit, the light may actually go out while you're doing a treatment, and that's fine. But when you're not doing a treatment, you should have a green light here. If you don't have a green light, you don't need to panic. You can still do a few treatments, but it's time to change the battery at that point. So you want to pop the battery compartment open, which will expose the battery. And it's just a typical 9-volt battery. But you really need to kind of stick with our recommendations on batteries on these. So we typically stick to either Duracell, Energizer, or Panasonic batteries. And we don't use rechargeables. They tend to stop in the middle of treatments. And we don't use other brands of batteries because it's a very odd thing in the world of 9-volt batteries, but not all 9-volt batteries are the same size. So some are a little bit longer or shorter than others. And that'll lead to problems because in a typical 9-volt battery presentation, you'll typically have a little cord that comes out with a little squishy pad on it that you put on the 9-volt battery. And the problem we've had with those in the past is that they break frequently. So we've designed a battery compartment that will snugly hold a 9-volt battery. The problem with that being that there are some 9-volt batteries out there that don't fit in here. So if you get a battery that's too small, it will jiggle back and forth in the unit and have intermittent contact, and you'll have problems when you go to do treatments with your patients. If you have a battery that's too long, it will either not fit in the unit or it will actually push the circuit board forward in the unit. So you need to be mindful of that. But do understand that it's a fairly snug fit for whatever battery that you put in here. So you're going to have to get a little screwdriver to lever it out. So once you push the battery in, the battery is going to snap in. And then when you go to replace the pad, the cover, it's going to feel like it's going to break, but it's not. It's a really, really tight fit. and it needs to have a really tight fit to hold that battery in there snugly so it hits all the contact points. And if you've done it properly, turn the unit on and the light should be green. If the light is not green and it doesn't turn on, it means you put the battery in backwards and you need to turn it around. If you turn it on and it does come on, but the light isn't green, you've gotten your hands on a bad battery. And I think we figured out that probably one in every, I think 100 or so 9-volt batteries that you get from the store will actually, you'll have a dead one somewhere in there. So that's all the features of the unit. So the next thing I want to go over with you guys is how to properly hold the unit and how to find acupuncture points with it. So I'm gonna pull this down a little bit here so you guys can kind of see what I'm doing. Let's make sure you guys can see everything here. All right. So with your unit that you got, you will probably have a manual of some kind that has some acupuncture points marked in it. So if we look at a protocol for, let's see, something like elbow pain, if you look beside each of the acupuncture points listed on the side, there will either be a, when you go over and look at the actual diagram, there's going to be a plus or minus next to each of the points. And the plus or minus indicates whether or not you need to use the positive or negative polarity on the unit itself. So to hold these, we've designed them to be held in really one specific way. And I see a lot of variations on this, and there's really only one that consistently works for people. So unless you have like some really bad arthritis and need to modify your grip, almost everybody sets a unit in the crook of their thumb, like right in this little cradle right here. And you'll notice that the unit has a curve right here in it. It's actually designed to fit right here, so it balances pretty well right here. You know, the center of balance is right there, so it carries most of the weight of the unit, so that it's not top heavy or bottom heavy. And you want to place your thumb on the metal plate and keep it there. So you're going to hold this like you would hold a pen or a pencil, okay? So you turn the unit on, and you're going to check and make sure the green light is on so that you know you've got enough battery power. You're going to roll it over, and you're going to use your middle finger. When it's time, you're going to use your middle finger to depress this button. But we're not going to do that just yet. So when you go to find an acupuncture point, let me turn this off. These units have a point finder built into them. And what you need to know is that acupuncture points have lower electrical resistance in the surrounding tissue. So they're more conductive to electricity than anywhere else on your skin. So this unit will actually find the points, and it does that by means of an ohmmeter that's built into the unit. And it's a very accurate ohmmeter. So when you go to use this to find acupuncture points, you need to be very, I guess, very intentional in the way you do it. If you move this around too quickly, you're never going to find any points. You've got to be very slow and deliberate in the way you do it. So I'm going to give you guys a little demonstration here on how to do it. What you don't want to do is put yourself in a situation where you're trying to hold the unit with your fingers around this side and trying to push the button with your thumb, because you're going to find out that it's very quickly going to cause you some problems. So again, cradle the unit, put your thumb on the plate, turn it on, and we're going to look for an acupuncture point right in the web of your thumb. It's called large intestine 4. It's called Hoku. And as I pull this across the skin, you're going to hear the tone start to change. And then when I get on top of the unit, there's a really high pitch, and it's difficult to see with this this camera, but the light actually goes out when you're on top of the acupuncture point. Now, if you're working with somebody who has really dry skin, so if you're in any of the northern states right now, you'll notice there are a series of switches right down here at the bottom. And the bottom one has wet, medium, and dry skin. So this is the sensitivity of the ohm meter down here. If you're just starting out, you are probably going to want to start with these units on the dry setting, which makes the tip more sensitive to finding acupuncture points. But if you're down south like I am, and you work on athletes, you'll find a lot of them have really moist and sometimes sweaty skin. So in those circumstances, you're going to want to slide the slider switch over to the wet setting. And what that's going to do is make the tip less sensitive, because your salt water is very conductive. So that means you're going to find false positives on your acupuncture points. And then in the middle, you've got a normal setting. So I'm going to put on the normal setting, and I'm going to cradle it. Put my finger over this button, but not touch it yet. And I'm going to slowly bring it down. And when I get on the acupuncture point, the light goes off, the pitch goes up, and at that point, I'm actually going to push the button and hold it down. And you're going to hear the unit beep. And so typically when we're doing treatments, you're going to count out, unless we say otherwise in our instructions, we're typically going to count out about 25 to 30 beeps on each acupuncture point. So it doesn't take a lot of stimulation to get some pretty amazing outcomes. And you can go anywhere to find acupuncture points that you know that there are. So you've got small intestine 3 up here. Oh, excuse me, small intestine 3 over here. Again, another good acupuncture point. There are a series of points you can practice on if you need to practice. There are a series of acupuncture points near the corners of your fingernails. Those are pretty easy to find. Because you can draw a line across the bottom of the nail and a line down the side of the nail. And where those lines intersect is going to be your acupuncture point. So it gives you a visual cue. So again, take the unit, pull it across the skin so you get a high pitch and the light goes out, and then hold the button down to stimulate the point. And again, count out about 25 to 30 beats. If you flip over, some other points you can practice on your wrist, we can look for some of the acupuncture points here. So if you bring your wrist all the way out, there's a crease that follows the bottom of your wrist right here. And then if you kind of fold your wrist back towards you, there's another crease. It's about the width of a pen or pencil away from there. So if you look, you'll see 2 lines here. Let's see if we can get that in the camera there. You'll see 2 lines there. And if you come from between your pinky finger and your ring finger, if you draw a line straight up to that second crease, there's one of the heart acupuncture points right there. So there's a little, if you palpate, there's like a little divot right down in there. You'll feel a little valley right there. If you move across this line, you can actually palpate for the radial pulse. And keeping in mind that if you were sticking needles in somebody, you wouldn't stick a needle through the radial artery. So if you come a little bit to the side of that, there's a little groove right there. So here you have one of your lung points. So you're going to point right there, point right here. And then if we go from this most distal crease, if we go 3 fingers up and go between the tendons right here, so when you flex up, it's usually pretty tender. There's a point there called pericardium 6, P6, which is used a lot for nausea during pregnancy, nausea during chemotherapy. It's a point that influences the chest and can be used for broken heart issues. So again, turn the unit on, put your finger over the button, but don't push it down yet. Pull it gently across the skin. And when the light goes out and the pitch goes up, you're on your acupuncture point, and then just hold the button down. And again, count out about 20 beeps or so. Now, if you're treating a patient and the patient complains that the stimulation is too intense, you can use the roller switch on the back of here to turn it down, okay? So in the middle of a treatment, if the patient complains, you can back it down a little bit with this roller switch until it's comfortable for the patient. So I'm treating, patient says, oh, that's too much. And on the fly, I can just roll it back and get within a comfortable, within kind of a comfortable area for the patient in terms of treatment. So that's kind of our, put this up so you guys can see. That's sort of our tutorial on how to locate acupuncture points. Before we move on to scar treatments, do we have any questions on how to hold the unit or how to locate acupuncture points?
I have a question.
Sure.
You said Duracell. What was the other battery?
Duracells, Energizers, and Panasonics seem to work pretty well.
Okay.
Stay away from rechargeable batteries.
Okay.
And occasionally you will find even a name brand battery that's made by a different factory that has slightly different parameters that won't fit. It's very rare, but we have run across that from time to time. So just be kind of mindful of that. If you stick to the basic battery brands that you can find at Walmart, Home Depot, Sam's, and stuff like that. And I think I've actually used the Sam's batteries in these before, and I think those work. But I'll have to check on that for you guys because I don't want you guys to go blow like 20 bucks on a bunch of batteries that don't fit. So,
okay.
I just generally stick to Duracells and Energizers. And so in typical use, I typically treat about 10 patients a day. And I use these for a minimum of 15 to 20 minutes on each treatment. And a battery lasts me probably about a month. So you can expect to get pretty long life with these things. Obviously, if you turn them on and you leave them on in your bag overnight, you're not going to have much left at the next morning. But other than that, they should last you quite a while. And like I said, even when the light goes off, you have enough battery power to do a few treatments. You're just going to start losing efficacy. So something that might have taken you 3 treatments to fix would take you 5 or 6 treatments to fix because you don't have enough electrons flowing to the area to properly stimulate it.
Okay.
Any other problem? Sure.
Can you hear me?
I can hear you.
Just wondered, what did you say that once you found the acupuncture point, the light would do what?
The light's going to go off.
Off. Okay.
Yep. So there are 2 indicators that you're on an acupuncture point. And one is that the pitch goes really high, and the other that the light goes off. But if you would like to hear a little trade secret from somebody who's done this for a lot of years, I will tell you that I rarely ever look at the light, and I always listen to the tone. Because what you have to realize is that people are going to have varying degrees of conductivity of their skin. And whether the light goes on or off, if you've got a really high pitch, then you are on the acupuncture point or close enough to the point to get the stimulation.
I'm sorry. High tip, did you say?
I'm sorry. Could you repeat that?
You say that high tip. I didn't understand what you said first. You said the light, and then there's another thing. The high tip.
Oh no. The pitch. I'm sorry. The pitch of the unit, the sound.
Yeah. Oh, the sound. Oh. Okay.
Yes, the sound. So you'll notice that the pitch will change. Like there's when you turn it on, there's a low pitch. When you get on top of the points, there's a fairly high pitch.
High pitch. Okay. Frequency, sound. Yes.
Yes. So the other thing that you do need to know is if you push down really hard with these, it compresses the skin, okay? And if you compress the skin, it makes the skin more conductive. So I can get false positives with one of these units simply by just going around and just pushing down really hard. Like if I push that hard, none of those are acupuncture points. But if I push down that hard, I'm going to get a false positive. So that's why I said earlier, you have to be very deliberate in how you go about this. You want to set the tip of this unit down just enough to compress the skin a little bit and then draw it along with slow and even pressure. If you move too fast, you're going to miss the points because it takes a minute to calculate the resistance of each point. And if you push too hard, you're going to get false positives. So, be gentle when you do this. Use steady pressure, but not hard pressure.
And can you treat a point longer than the 20 to 30 seconds or do it multiple times?
Yes, you can.
Okay. And how would we know if we needed to do that?
Well, let's say you had somebody who was having an asthma attack, an active asthma attack, or like a seizure. There are specific acupuncture points for those. You're going to hold it on that point until the problem resolves.
Okay.
So in emergency situations, you're going to hold it on there for as long as it takes. And there's certainly no harm in going back and retreating a point or holding it longer. Our protocols are generally designed for practitioners. Once you've kind of learned how to do this, our protocols are generally broken up into kind of like 15-minute segments. So we set up the protocols so that you can get it done in about 15 to 20 minutes and still have the rest of your treatment time with your patient to do what you need to do. So based on that, that's how we kind of figure out the time, and you'll get good outcomes with that. Now, if you have an hour, then you could certainly spend a little more time treating points. But you'll be surprised what you accomplish with a very fairly small amount of stimulation out of it. But anyway, let's go over how to treat a scar. The really nice thing about treating scars is that you don't have to really know how to find an acupuncture point to successfully treat a scar. So that's kind of a nice thing, right? All you have to do is be able to hold these units and turn them on. So I'm going to draw a couple different scars for us to look at here. Let's see, hang on just a minute. We're going to change things around a little bit here. So you guys can see a little bit better what's going on. All right, that helps us out a little bit there. Okay. So there are two basic kinds of scars you guys are going to see. There are linear scars. So there's our linear scar right there. And then there are scars that are more like trauma scars. So they may be kind of round like this, got punctured by something or burned or whatever. And it doesn't really matter which type of scar it is. You're going to do the same basic thing with the scars. So to properly do scar treatments, you're going to need 2 units. And earlier we talked about the settings of the units. So when you look at the settings, you're going to want one of them on the negative polarity and one on the biphasic polarity. So each unit is going to have a different setting, okay? And the physics behind what we're trying to do here is to pass electrons back and forth across the scar. So we're trying to flood the scar tissue with electrons. The problem with that is that scar tissue is not particularly conductive to electricity. It's part of what defines a scar. So scars have basically lost their capacitance and are depolarized tissue. So if you can repolarize this tissue, a number of things happen. So when you treat a scar properly, if you measure this stuff on diagnostic ultrasound, you are going to see a change in what's called the cicatrix gray mean density. So you can look at this on an ultrasound and you'll actually see the scar change visibly, like while you're doing the treatment. if you were looking at it on ultrasound. And when the gray mean density of the scar changes, the plasticity of the scar changes as well. So it becomes more elastic. So if there are any nerves that are entrapped by the scar, even small nerves that run up towards the surface of the skin, it releases those. It's also going to release fascial pull, like anywhere around the scar. So the scar may be really uncomfortable because it's just pulling, fascially pulling around that entire area. So it's going to release that as well. In addition to that, when you get into really deep scars, like deep abdominal adhesions, you can release some of the pressure on internal organs. People tend to have a lot of discomfort sometimes from C-sections, hysterectomy scars, appendectomy scars, and some of these scars can be quite old. So it doesn't matter if it's a 50 or 60-year-old scar. I treated some of those, or a scar that's a year or two old, or even a fresh incision. You can actually do this very same thing around surgical incisions. So a lot of physical therapy clinics that use this modality actually use this post-operatively on total knees and hips and shoulders and stuff like that, because when you run the current through there, it increases the ATP production by 400 or 500%. So that's the mitochondrial fuel. So it speeds up the healing process. So there's a lot less chance that you're going to get more extensive scarring in the area. So when we treat these scars, you want to basically play ping pong with electrons back and forth through the scar, okay? And so the way we're going to do that is to take a unit in either hand, and we're going to go on either side of the scar, just outside the boundaries of the scar. So I'm going to put a series of X's here. And if this were an actual scar, I would be doing this in probably 1/4 inch segments. So I would turn the units on, put my thumbs on the metal plate, touch down on the patient somewhere. It doesn't have to be with both hands. One hand is enough, but the more skin contact you have with a patient, the better off you're going to be. Now, sometimes the patient's going to have dressing around a wound or something. You may have to go farther outside the boundaries of it. But you're going to go on either side of the scar, hold the units down. You're not trying to locate acupuncture points. So don't expect the light to go off. Don't expect to get a really high pitch. Don't expect the light to go off. This is all about trying to drive electrons back and forth across the tissue, and it's non-conductive. So that's why you have to push with one and pull with the other. So what's going to happen is my unit that's on negative polarity is going to push electrons in to the tip, and the other unit is going to pull the electrons across through the tissue. It's going to up, and because we're using biphasic setting, it's going to kick them back across the scar. So it's going to bounce back and forth across the scar all the way up. So you're going to turn the units on, set them down, count out about 15 beeps. Some people say 10 beeps, 10 to 15 beeps. Then you're going to pick the units up, move about 1/4 inch, and do the same thing again. So each time you do that, you're moving about 1/4 inch through or along the length of the scar. So once you get to the end of the scar, you're going to then try and hit the areas between what you've already treated. So you're going to look for those little gaps between the, I guess I'll put O's in there so you guys can see it. You can look for the little gaps between the X's, and you're going to go through and treat those. And again, the idea here is not to treat acupuncture points, but just to bounce electrons back and forth through the scar. So you're going to keep going and going and going and going until you get to the end of it. So you've done one pass this way. You're going to do another pass this way. And then if you want, you can actually switch the units in your hands so that the negative is on the other side, and you can come back again. So that's 3 passes in total, okay? Up, down, up, or down, up, down, however you want to do it. Like passing electrons back and forth through the scar. So a question I get from people is, hey, like if this works so well, why don't you just put a pad on either side of the scar? or just take a TENS unit and put one on there. And the problem you run into is that if you don't concentrate it through the tip of this unit, your chances of actually getting it to go through the scar tissue itself are very, very limited. And on top of that, this is low frequency direct current, and this has a very specific effect on scars. When you start getting to like high frequency alternating current, it just doesn't work as well. That's why TENS units don't really fix scars, but you can change a scar with this. Any change that you make to a scar with this device is permanent. So what you can expect is about a 20% reduction in the density of the scar. Sometimes this could be a lot more than that, but we know from looking at ultrasounds, you're going to get about a 20% reduction in the density of the scar. So on average, with a typical uncomplicated surgical scar, or even older scar from some kind of trauma, you're looking at about 5 treatments total. So you can kind of calculate it for the patient. So you look at the first visit, it's $150, and follow visits are $90. Like, this is about how much you're going to pay. That's going to change a little bit if you get into a situation where you have patients who have deep abdominal adhesion. So they've got scar tissue wrapping down around the scar. And an example is like a patient I actually had today. So I had a patient come in today who has some scarring in her right breast. So she had breast cancer, and they did some radiation with her. And in part of the radiation, they put an incision and put a balloon in, like kind of right above her nipple, and blew it up. And I guess, I don't know if that was to hold the tissue taut while they were doing the radiation. I'm not sure what it was for. All I know is that was about 8 years ago, and she has had excruciating pain ever since they did that. She's alive, so the treatment worked. She got rid of the cancer, but she just has excruciating pain there. And she has been everywhere. She's been to all kind of manual therapy places. She's had gua sha, she's had needles, she's had all these different things done. And none of it has helped out her pain at all. And when you palpate, so she's got a scar that runs from basically near her armpit, where they took out some lymph nodes, all the way up to just above her nipple. And right above her nipple, it feels like there's a golf ball under there. I mean, and she said you can't even touch it. It's so painful. She said it shoots electric pains all around her nipple. Very, very uncomfortable. So this was kind of the last stop for her. And so we did the treatment, and conservatively, she has about 70% less pain after the treatment than when we started. And you can actually touch it now. She doesn't have radiating pain out in her nipple. It's more local pain in the area. And the actual golf ball feeling of that scar is starting to go down a little bit. My expectation is it will probably take more than 5 treatments to fix this up, because there are a lot of, if you look at an acupuncture doll, there are a lot of meridians that run through this area. So you're getting into the stomach meridian and heart and lung. There's all kind of meridians in acupuncture that are cut by that scar. In addition to that, that scar is going to affect lymphatic flow to some degree. So I'm going to have to do some lymphatic type work with her, and do some work to push energy along the meridians. And scars like this can actually have a fairly dramatic effect on the autonomic nervous system. So scars can bring up your overall level of arousal and kind of keep you in pain. It stimulates the sympathetic nervous system. So when you treat a scar, it'll actually increase your heart rate variability and bring up the parasympathetic side of the nervous system, which is going to help your body calm down. So it'll generally lower overall pain.
Is the pressure the same?
You're going to use a little bit more pressure because you're not worried about finding false positives. Obviously, on this lady, I had to go. So we're going to use this as kind of an example of what I did with her. And this isn't what the scar looked like. The scar looked more like this, but the golf ball feeling thing under her breast looked about like this or felt about like this. So I couldn't start directly on either side of it. I actually had to go pretty far out. Okay. So when I did this, I had to work way out. And then as it started to desensitize, I worked closer and closer in each time. So where's my pen here? So you always want to work across the scar for the most part for this part of it. So if you're doing if you're doing negative on one side, then you're going to want to use biphasic setting on the opposite side of the scar. So instead of doing it as a line, I'm going to work around the clock, if that makes sense to you guys. And just keep going around it. And same thing with the scar, I'm going to go around it 3 times, okay? So 1, 2, 3 times. And then once I've gone around the scar either 3 times or up and down 3 times, I'm then going to work through the actual scar itself, because at this point, you're starting to get some electrons bouncing back and forth through this tissue, and it's starting to open up, okay? So you've kind of done this kind of thing, and you're just bouncing through there.
So it's always 3 times around?
That's for starters. So like I said earlier, we work to try and keep these things within a manageable amount of time. And you might have a really long scar. Like you might have a scar from somebody's throat all the way down, almost to the pubic symphysis, depending on what's been done to them. So you've got to be able to do this in a reasonable amount of time. I will certainly go back over a scar multiple times if I have time. But it's kind of a time dependent thing. So once you have treated around the scar or up and down the scar, you actually want to work through the scar. So if you start at either end of the scar, again, counting 10 or 15 beats, going about every quarter of an inch or so. So at this point, I'm actually pushing electricity like right through the scar. And again, I might do that 3 times. And then I'm going to go to the ends of the scar, and I'm going to do what's called plugging the scar. So I'm going to hold a unit at either end of the scar for about 15 or 20 beats, and that'll kind of complete your basic scar treatment. So that's kind of the basics of how we go about treating the scars. Any questions on scars before I move along to anything else?
Do we need to be concerned with hardware underneath the scar at all?
No. Occasionally patients will feel, they'll feel it in the nerves around the area, but there's no contraindications in terms of, there's no contraindications in terms of hardware, plates, screws. If the patient has a dorsal column spine stimulator, I tell them to turn that off. But that's about the extent of it. Where the things I would shy away from, so we can kind of get into contraindications for a minute here. There are some rules that we follow, and they're not necessarily always hard and fast rules, because there are exceptions depending on what the patient's doctor says. So the general rules are this. I've got a little bit of ink on these units. I need to clean this off. Hang on a second. So don't stick this anywhere you wouldn't stick a pencil. So don't stick it up your nose, don't stick it in your eyes, don't stick it way deep in your ears. Other than that, you're pretty good. We even have people who put attachments on here. There's an extension probe you can put on here. We have some people who use these intraorally for dental scars and for TMJ stuff. We have some people who do pelvic floor stuff who put a special tip on here, and then they use it vaginally or however they need to use it to treat deep scarring, internal scarring. So, but again, don't stick it in your eye, don't stick it up your nose, and don't stick it in your ear, like way deep in your ear. That's a bad idea. Other things you want to avoid. So don't treat overactive cancer tumors unless the doctor specifically tells you to, and they might. There's actually a therapy these days that uses microcurrent to treat brain tumors. It's a big, huge machine that kind of looks like, I don't know, a cross between a giant MRI and something else. They actually it uses microcurrent like these to treat brain tumors. So it does seem to have an effect on cancer in a positive way, but I wouldn't do it unless first of all, I wouldn't treat cancer with this because it's not an indication. But you just don't want to treat overactive cancer tumors unless the doctor tells you to. After a patient is clear of cancer, you're fine. So just the general thumb is check with the doctor first. If the patient has a pacemaker or defibrillator, and it's not within your scope of practice to determine whether it's safe to treat that, you need to check with the whoever their physician is who's in charge of that kind of stuff before you treat with those kind of things. Other things you probably want to avoid, I wouldn't stick this directly over the carotid artery and hold it for a long period of time. And it's more about the pressure on the carotid artery because that can cause some issues. You don't do massage work over the carotid artery either. Don't stick it in a wound. So if one of our scars here were an open wound, it's okay to treat around the outside of the wound, and it's actually a really good idea. I filled up some non-healing diabetic ulcers by treating around the wounds, but don't treat inside the wound. And that is pretty well it on contraindications. Don't stick it on top of your head. Don't stick it on top of your head if you have seizures. That being said, there are acupuncture. Don't stick it on top of your head if you have a history of seizures. So don't stick this dead at the very top of your head if you have a history of seizures. That being said, there are specific acupuncture points that will stop seizures. I've done it before. They're emergency points, and there are acupuncture points that are used for people who have a history of seizures to bring down the frequency of their seizures. Clearly, that's not what we're treating or talking about today, but so there are some exceptions to things. You just have to check with the patient's doctor if there's an odd condition of some kind. Any questions? Any other questions on contraindications before I move on?
Question about the ear. I'm doing something with the ear, and I just wanted to know, in the booklet it said, showing you what to do here, where you put it, and it said minus. At one point it says stimulate for 30 seconds on, in parentheses, minus VE polarity, and another time it'll just say minus polarity. So obviously I know what minus polarity is. What's minus VE?
It just means negative. It's just a type instead of, yeah, they both mean negative. They just written two ways. That's all. Okay. So like if you want to chalk it up to like a typo, call it a typo. But it's not really a typo.
They have VE on every single point.
Right.
And minus VE on, diaphragm, long interference, and then all of a sudden I'll just go minus the interference.
Right. Yep. It means the same thing. Don't worry about it. You're good.
What does VE mean?
Well, positive, negative. So it's just sometimes people get a little there have been times when people got confused about the symbols. So for a while they put the VE at the end of it to indicate negative or positive. They end with VE.
Oh, so VE means okay.
Yeah, it's just part of it. Any other questions on contraindications before we move on? We got to move on to setting up vagus nerve stimulators here in a second. You guys good? Okay, so let's move on to setting up the vagus nerve stimulator part of this. Let me get rid of this. So we're going to go over the stuff we have here. Open our Dolphin box here. You're going to have a little bit of paperwork in here. You're going to have a black cord that looks like this. And it's got a little cup at one end. And it has a male prong at the other end. You're going to put that over the tip of the unit. Things you need to know, like if you look inside here, you'll see there's a little bit of metal. The tip of this unit has to contact that. You can't just place it on here and expect it to work. You have to put it on there firmly. Like don't push it so hard that you break it, but just push it on there because we need this tip to contact the metal plate in there. So you're going to slide that on there. And then we're going to look in our other little bag here. There are a couple of ear clips. So some of your ear clips may be black, some of them may be white. They're the same. It's just different colors. Firmly insert this in. And you're going to take this and put it on your patient's, for the most part, left earlobe to start out. Check the patient's ears. If their earlobes seem really dry, you might want to moisten this a little bit. Just put just a little dab of water on it. I'll show you what I use. I have a tube of EEG conductive paste, which is called 1020. It is really, really sticky stuff because it's used to stick electrodes to your head, and it's very conductive. It is kind of gummy though, so you're gonna have to clean these really thoroughly if you use this stuff, but this tube will be enough to last you for your lifetime of doing vagus nerve stimulation on patients. So you're gonna take this clip and you're gonna put it on the patient's earlobe, on their left ear. Then if you look in the pack here, you're going to have some different types of electrodes, and you're going to have a white cord. So we're going to pull out our white cord and open that up. And the cord looks like there is a male end and a female end, but it's actually a trick, because if you look inside, this is actually a shroud. And if you look inside there, there's actually a male tip inside there, okay? So don't get confused. Like, both of these ends are the same. One of them is just shrouded. So you're going to take your unit. So you've already got your tip plugged on there, and you're going to go to the metal plate. You want to use an alcohol wipe. So there's some alcohol wipes here. You want to use an alcohol wipe and clean the plate off, okay? So you're going to clean that off well. Dry it off. You don't want any excess oil in there, or the electrode doesn't stick as well. And once you've done that, you're going to find a pack of little oval looking electrodes. And we have these electrodes specially made for these units, so they're cut to fit perfectly. You're going to pull one of these out, peel it off, and you're going to stick it on this metal plate like this. Then you're going to take your white cord and connect the male and female connector there, like that. So now you're left with this shrouded end of the cord here. And you have another package of electrodes that are rectangular. You're going to pull these out, and you're going to take one of these out, and you're going to take one of your alcohol wipes, and you're going to clean the patient's left wrist. I've got a bunch of ink on here from the demonstration, so excuse that, guys. So clean that, dry that off really well. Once you've got that dry, you're going to take your electrode and stick this female side into the shroud, and it'll connect to the male prong in there. You're going to peel it off, and you're going to place it across your wrist in that same area where I was demonstrating acupuncture points before. So you got it on. So now you've got a clip on your ear that's connected to the tip of the unit on your left ear. And you have an electrode here on the metal plate that's connected to an electrode on your wrist. So at that point, you're going to turn the unit on. When you turn it on, the light should be off. Like, if you've got a good connection, the light's going to be off. You're going to put it on the negative polarity. And this is important, guys. If you put it on the positive polarity, you're not going to kill your patient or anything, but it has a tendency to bring things up a little bit. And we're trying to bring things down. Like, it's not going to push them over the edge of homeostasis. but it's not going to help them get down as quickly as we need them to. So put the units on the negative polarity, go to the back of the unit, and push this little button right here. And then you're going to notice that the button is going to start, that the light is going to start to flash on there. And this is going to stay on for anywhere from 13 to 14 minutes. And after that time, it's going to beep. And at that point, you have a choice of pushing the button again and making it go longer, or turning the unit off. So the first time you treat a patient, you want to do it in the office. Like sometimes I actually send these units home with patients. But the first time the patient gets treated, I always want to do it in the office, and I always want to use the left-hand side, and I want to do it for about 5 minutes. And that's it. That's all I'm going to do. The first time I treat them was about 5 minutes. And I typically do it near the beginning of the treatment, even if I'm doing scars or whatever else. If I'm doing vagus nerve stimulation, I'm going to do this for about 5 minutes and just check on the patient, because sometimes it's like flipping a switch for the patient, and it really relaxes them, and they have to kind of get used to that sensation, because sometimes they've been really, really wound up and they need a minute to kind of process how they feel. After they get past that first treatment, I'm going to slowly, if I'm doing it in the office, the next time I treat the patient, I'll do vagus nerve stimulation for about 10 minutes. And I'll work up over the next few weeks until I'm doing it between 20 and 30 minutes with each treatment. So questions then become, the questions people ask are, well, how often do you need to do this? Well, if you're an average person who really doesn't have any problems, if you're just trying to do maintenance work, so I'll use this on myself, like maybe once a week. If I've got a really stressful week, maybe twice a week, but I'm not going to go over that. If I have a patient who has a lot of pathology going on, so somebody who is, what are some things like chronic, like toxic mold exposure, I'm going to want that patient doing this daily. So they need a unit at home they can treat with. If the patient has serious systemic inflammatory conditions, autoimmune diseases like MS and things like that, definitely I want them to have a unit at home to use every day for a while to bring all that down. If the patients have a lot of psychological trauma that they're working through, so this seems to work well for people who have a past history of trauma, and it helps to kind of process that through for them. I would start out with a couple times a week, and then I would work into having them do this on a daily basis for a little while. That being said, if they're doing it at home, you probably want them to do it in the evening, and it will actually help them sleep a little bit better. So anyway, that's the basics of how to do this. Now, if you find that the patient is, after you do this a few times, if the patient feels really, really sedated, you can actually take this and switch it around. You can put this clip on the right ear and put this electrode on the right wrist, and you can put it on the positive polarity, but only do it for about 5 minutes. And that's just going to kind of balance things out a little bit, but you don't want it to overshoot what you've done with the left ear. So that's the basics of how you set up the vagus nerve stimulation system and use it on patients. Do we have any? I know we're kind of getting close on time. You guys have any questions?
Yes, please. What about using this for someone with lymphoma who is treating himself naturally, but having trouble sleeping? It sounds like this would be good for something like that.
I would think that it would, but I would check with whoever the treating physician is. So, for example, there are integrative oncology clinics that are treating people for lymphoma and stuff naturally. But I would just check with the treating physician. You always want to stay on board with whoever the treating physician is, because they may have some underlying reason they don't want you to do this, right or wrong. I can tell you that my sister right now has breast cancer, and I have her doing this every day. But I'm not a doctor, and that's my sister. So, I'm doing what she wants to do. Other questions?
Yes, I have a question. On
Sure.
my black cord that has the pin looking end on it,
Okay,
when I attach it to the tip of the white device,
okay.
it does not stay on. It just works. It just gradually comes off. So it's
Okay,
not
this,
tight.
okay, so when you take this cap and put it on here, it's not staying on.
Right.
Okay, so there are two things that you can do. There is when these things are cast, there is a releasing agent that's used. So these are in a plastic mold, and there's a releasing agent that they use that doesn't always get completely flushed out. So if you take an alcohol white
Mhm.
and just really thoroughly work it through there, like really soak it and work it well, that will typically, the other thing that you need to make sure of is make sure the tip of your unit is really clean. If you've been handling this with massage cream or something like that, this will get slick and it's easy for it to pull off. If you
Okay.
clean this a couple of times with alcohol and you know that this is dry and it continues to do that, if you will contact us, we can send you out a replacement for it.
Okay.
Just occasionally the releasing agent just doesn't properly get flushed from there. And, we can't obviously check every single one of them because these things have to be packaged to be sterile. So sometimes one of them gets through, but if you just let us know, we can send you out another one and you should be covered.
Okay. All right. Thank you.
Sure. Next
So
question.
I have a question. My name is Rita. I got my device just the other day, and it
Okay.
does not turn on. So I get no light. I turn it on, but there's no green light. I thought it didn't come with a battery. I opened it up. I see a battery in there.
Okay, so when you turn it on, does it make noise at all?
No noise, no beeping, no nothing.
No, nothing. Okay, so there are two things you want to do. The first thing you want to do is you've looked in there and you've seen the battery.
Yes.
But if you open it up, the first thing I would do is I would pop the battery out and turn it
Okay.
around and then try it. And that may solve your problems. It's possible the battery got put in there backwards. I haven't seen that happen, but somebody put the battery in there, so they could have put it in there backwards. So I would try that first.
Okay.
And if that doesn't work, I would buy another battery and put it in there. Because like I said, about 1 in every 100 9-volt batteries. So we buy the batteries in bulk from whoever the manufacturer is. And about 1 in every 100 of these batteries will actually just be dead, straight out of the box from the factory. Sometimes it's 2 in 100. So double check with that. And if you continue to have problems, just call our service line, and we can get your work through whatever's going on.
Okay. Thank you.
Yes, ma'am.
Is there more continuing ed on this that you offer or online somewhere?
We do. So we have online courses that we do. We have whole entire courses on scar tissue. We have courses on how to do this. We also have a lot of in-person workshops, and obviously most of that stopped with COVID. But we have a whole entire in-person scar course. So we've got scars. What are some of our other courses? Let's see if I've got any of the books here. We have an introductory course that we teach. These are typically weekend courses, so they're 2 to 3 day courses. And we'll have them listed on the website. We have a concussion course, concussion brain injury course.
Oh, great.
We have advanced circuits. We have orthopedics courses. We have done home health courses for home health therapists. For home health and nursing homes. We have a pediatric course. We have a lymphatics course. I'm trying to think what other courses we've done. We do some hybrid courses sometimes and incorporate elements of other things. So there are a lot of courses available. Keep your eye on our website because we'll be posting those as they become available. Like I said, we're just getting started with these again. because for 2 years now, nobody has done courses in their hospital. We do a lot of courses for the military and hospital systems, and all that just kind of came to a screeching halt. So, and if you have people in your area, like if you get on our web forum and say, hey, does anybody live in, I don't know, Arlen, Texas or whatever, or close to this area, and who, you know, is there anybody close to me who wants to have an introductory course? And people who are plugged in will say, sure, I'd love to have one. If we see enough interest online, then we can put together a course in your area. We just need to know that there's enough interest to be able to put on a course, because if we put on a course, we typically have to fly an instructor in. We've got to ship all the equipment in for it. We got to pay for hotels, and we've got to pay for conference rooms. And, you know, we have to have enough people to make it financially viable to come to the course for you guys. But typically if you get, I think it's like 12 people, we can make it happen. If you have a location like a clinic or something like that, that has some therapy tables in it, that makes it a lot easier for us. So there's, there are definitely ways to make it happen. And I love teaching these courses in person. That's one of my passions. I've been doing this modality for probably about 20 years and teaching it for, I don't know, 18 or something like that. And it's fun. It's different to see it online than to see it in person, because when you do it in person, somebody's going to grab your hand and say, hold it like this. You feel that pressure. You're going to be in close. You're going to see actual treatments happen. You're going to see people who have problems get better. You're going to be able to see and feel the differences in how a scar is treated, and really get a hands-on look at just how quickly this modality can work. And it's fast. Like it is really fast. Like the lady today who had that scar above her breast has been there for years and nobody's been able to do anything for her. And she's been all over. She's been to specialty clinics in Atlanta. I'm in Georgia. She's been to Atlanta. She's been to Orlando. She's been all over the place. She went to a nonprofit place specifically for women who've had breast cancer and breast surgery who have pain, and they couldn't fix it. And I spent about 20 or 30 minutes on her today, and 70% of her pain is gone. So it's a really quick modality to learn it.
Will you post that website again? The website, MPS courses? What is the website?
Heffy can probably type it out for you. She's moderating the course. All I have right here is my cell phone, so I can't really post it for you guys.
Gotcha.
But we do. It's on Facebook. So we have a forum on Facebook, and if you request to be a member of the forum, you'll get approved because you've got equipment. You own equipment.
Okay.
You just make sure you agree to our policies, though. The policies are like, don't steal our stuff and behave yourself. People do steal our ideas sometimes. All right. Other questions?
I have a question. And when you said that you hold, when you do the acupuncture, the device in one hand and then you touch the patient, do you touch it with that hand, with the other hand?
It doesn't matter.
And do you touch
touch
them in the shoulder?
Okay. You can grab behind the ear, you can forehead, you can put run your fingers through the scalp. If you really,
the hand that you're not using with the device, right? It's that hand.
Right. And if you really have problems getting contact, one of the little tricks of the trade is that you can stick this on here, and I can take this, and I can put this on my wrist or wherever, on the I can put this on the patient. Okay. So I could take this electrode, stick this electrode on the patient, turn the device on, and then I don't have to put my thumb on that metal plate because I'll locate points. Does that make sense?
Yeah.
You're going to run through a whole lot more pads that way, but you can certainly do that. If you have problems or you just like to do it that way, you can certainly do it that way. It's just not quite as efficient.
Thank you.
All right, we're running tight on. Okay, we're running tight on time. A couple more questions. What is the what?
What's the pen device used for?
Yeah, let me grab one here. So this device fits over the end of the unit. Again, you got to get contact with the little metal plate in there. This is flexible, so you can bend it. Okay, and it's used to. It's really primarily a tool for self-treatment. So I have a lot of elderly clients who really don't have very good range of motion, but I want them doing some treatments at home. So I'll send them home with a unit that is attached to it. And they have to touch the metal plate and push the button. But if they can actually take this to a back scratcher, and they can actually treat points in the back. But this is the device that people will use this for doing like vaginal treatments and stuff like that. So, and oral treatments. So we actually make the patients, when I worked in women's health, when we did episiotomy scars, we would make the patient buy 2 of these. And they had to be cleaned every single time. So the patient would take these home and clean them and bring them back. So it's just a self-treatment device, but it can flex into in-clinic treatment. So we're running pretty tight on time now. I'll take one more question, and we're got to wrap this up.
Can you please talk a little bit quickly about when the vagus nerve, when you're doing the stimulation for that, about putting the pad on the abdomen instead of the wrist? And do you do both ears or just one ear?
Typically, you're going to do the left. Typically, you're going to stick with the left ear, even when you put the pad on the abdomen. So initially, we tested the equipment running the pad from the ear to the abdomen, because that's really the course of the vagus nerve. And when we ran the, you want to have statistical outcomes when you do this stuff. So you want it to be scientific. So you want to have statistically significant outcomes when you're trying to modulate things like heart rate variability and high frequency vagal tone. And we found that it is very effective to put this on the abdomen, especially if the patient has gut issues. But in approaching statistical confidence, we're only getting into that like the 80s, I think it was the 87th or 88th percentile. And you really want to be up in the 95 to 97 to 99 percentile. So we found that when we put it over onto the wrist, we were getting more consistent outcomes. So that's just the difference. But you can certainly try it on the abdomen if you'd like. Certainly nothing wrong with that. And if you're going to do both ears, you're going to do the left ear for 20, maximum 20 to 30 minutes or so. And again, the right ear, about 5 minutes. So you're always going to do more on the left ear than the right ear to keep things, calming down. All right. That's the last question we can take for tonight. We're already about 20 minutes over. All right. So thank you guys so much for showing up, and